on this computer. All right, here we are. We are live. Good morning. We are excited to be here live with two renowned fertility experts, Dr. Liesl Nel-Themaat, Director of the IVF Lab, and Dr. Polotsky, Director of the Reproductive Endocrinology and Infertility Division with the University of Colorado Anschutz Medical Center. They are here with us today to answer questions about infertility treatments and pregnancy during the coronavirus. Thank you so much, doctors, for taking the time to speak with us this morning.
Good morning, and thank you, Jackie. We're happy to be here to answer questions in this difficult time.
Yeah, thank you. It is a very difficult time and confusing as well, which is why we're so happy to have you both here to help us answer questions today. To our listeners who are here with us right now, thank you for joining us. If you have any additional questions that are not answered during the interview, please submit your questions in the comments, and we'll answer as many as possible at the end. Okay, let's get started. Can you start by telling us why infertility treatments are being put on hold?
Yes, good morning, Jackie, and to all the listeners. Most medical disciplines are governed by professional societies that publish guidelines on an array of different topics that are relevant to their particular field. And as infertility specialists in the US, most clinics adhere to the guidelines published by the American Society of Reproductive Medicine, or ASRM as we know it. So when the coronavirus outbreak started, the ASRM put together a task force and composed guidelines about specifically what they recommend we do during this outbreak as far as fertility treatment goes. Mm-hmm. And the current guidelines recommend that no new non-urgent cycles should be started for the safety of the patient, the staff, as well as the whole community. So the task force considers information set forth by the WHO, the CDC, other local and national regulatory agencies, as well as considering the voice of its members and the patients to put together these guidelines. These guidelines are reviewed every 2 weeks, and they may be amended or updated accordingly. And any such updates, if it changes what we may or may not do, the clinics will typically modify their practices accordingly.
Okay, great. And you mentioned that those are modified every 2 weeks or checked.
That's correct.
Okay.
And the next time it's going to be reviewed is 2 weeks from tomorrow.
Okay, good to know. All right. Next question. While the majority of the U.S. is on lockdown, there are still some towns that are not, and clinics remain open. If my clinic is closed, should I go to one that is open?
We advise our patients to delay initiation of any fertility treatments at this time. Mm-hmm. In our clinic and many others are open for telehealth visits, and we have been seeing a lot of folks who are successfully using this technology. It is super easy, even for individuals who are not tech savvy. But the bottom line is that at present time, any non-urgent treatments or evaluations should be delayed or postponed, and local conditions could also be different. And so right. Things are very different in New York City or in Colorado or in Idaho. So you right. should check with your local provider.
Yeah, so in Idaho, it might not be the same issue as it is in New York, which we all know is an epicenter for what's going on.
Right.
Right. Okay. Next question. My clinic is still doing treatments, but recommending freezing my eggs or embryos. Will freezing them reduce my chances of success of getting pregnant later on?
We definitely advise all individuals, men, women, or couples who are seeking fertility treatments to discuss the individual circumstances that are often unique with their provider. But it is reassuring to know that that frozen eggs, sperm, or embryos could be maintained indefinitely. There's actually been a story a number of months ago about an embryo that resulted in a live birth after being frozen for more than 20 years.
Wow.
Yeah.
So that's reassuring.
Yeah, absolutely.
Yeah.
So I think if somebody is currently in treatment, a freezing is the safest thing to do.
Great. Okay, this is a follow-up question to the one we just asked. Will my eggs or embryo be safe frozen since my treatment has been put on hold? What are the risks?
The art of freezing eggs and embryos especially has really been refined over the last few years, and is to a point now that we get well over 90% survival. In our lab specifically, we are around 95% survival, if not more, for embryo thaws. So we can definitely reassure patients that the risk of freezing your eggs and embryos and sperm at this point is very, very low. The survival really is very high. Another concern that patients have, especially after the reports a few years ago about the tank failures, is, are my specimens going to be safe during storage? Certifying agencies now require all their labs to comply to very, very strict criteria. You have to have continuous monitoring of your tanks. You have to check the liquid nitrogen level, and liquid nitrogen is what the specimens are stored in. And you have to have an alarm system, do physical checks. So we have very, very strenuous procedures that we have to follow. At our lab, we actually have two different systems. We overkill because we are so, it's just such a tremendous loss if something does go wrong with a storage tank. So we have temperature probes that's inside each of our tanks. And then we have a secondary alarm system that actually looks with thermo cameras at the room, and we can see each tank. And the first signs of failure often, or it usually is, for a failure in a tank is that the temperature on the outside drops, and this camera system can warn the lab and call us 18 hours earlier than most alarms can. So we now have two systems because it just makes me sleep better at night. So every night before I go to bed, I actually look at my embryos on the camera.
Aww.
That everything is good. So storage these days are very, very well controlled, and any reputable lab will have alarm systems in place to call if anything goes wrong.
Okay, that's reassuring. And is that standard for labs across the U.S.?
So most labs that are adhering to the gold standard of certification, which is the College of American Pathology, who we adhere to, they are required to have these systems in place. However, not all labs necessarily do get certification by the College of American Pathology. So it would be a good idea to check with your lab and see what certifying agencies they are following and what their procedures are.
Great advice. Thank you. Okay. And here's our next question. It's a bit of a loaded question, but it's asked by many. It sounds like fertility treatment is being paused because it is considered an elective procedure. For many women, this is their only option. So why is this being considered an elective?
Yeah, that's a question that comes up quite a bit these days. It is appropriate to make distinction between something that's considered to be urgent and non-urgent. And non-urgent fertility treatments are not elective. Infertility is a disease, and treatment of any disease is not elective. Non-urgent is usually understood in a way that any treatment or evaluation would not be time sensitive and would not be affected by a delay of a couple of months. Now, we're complying with guidelines of American Society for Reproductive Medicine, and we are not initiating any new non-urgent fertility treatments all this time. And circumstances that are different, individuals, men and women and couples who require freezing for eggs, sperm, or embryos because they're facing imminent cancer treatment are different. So we're open for those procedures at this time. But it is an important distinction between non-urgent and elective. And so we definitely implore everyone to understand what that implies. And we are definitely not saying that it is elective for folks to have the family they want. It is not. We're here to help.
Great, thank you. Thanks. Okay. Any advice for women who are concerned about spending treatment due to their age? Will a couple of months make a difference? Oh, bless you.
It must have been a great question because it woke me up a little bit. So this is definitely a very sensitive topic for many patients. And while a couple of months would usually not make a difference for majority of folks, individual circumstances may vary. And there is definitely folks who might be affected by age-related decline in fertility. And my heart really goes out to people who might be affected by impact of this delay. And I think the worst thing is that we really are not in a position to estimate how long it will take. And so
Right.
these conversations that now I'm having on a daily basis with the patients who I'm counseling. But unfortunately, at present time, we should do whatever is safest and not to initiate any treatments that are not recommended by our professional society and by our government advisors and overseers.
Yeah, thank you. Thank you for answering that question. Okay, so what should women who are in the middle of treatment, whose appointments have been canceled, expect to happen now?
So it really depends on what type of treatment they are pursuing and where they are in the process. If they haven't started any type of stimulation, the guidelines are that we should take a pause and delay it until the pandemic has subsided or until the guidelines tell us otherwise. If you are doing an ovulation induction cycle for inseminations, for example, and you've already started your stimulation, then the guidelines say that we can continue with the stimulation and do the insemination and just not start any subsequent cycles. If you are in an IVF cycle for either egg freezing or to make embryos, if you have already started your stimulation, the guidelines let us continue with stimulation and do the egg retrieval, and then those eggs or embryos will be frozen because the guidelines do recommend not to do embryo transfers at this point. And like I've explained before, the egg and embryo freezing procedure is very effective, it's very safe, so we can with confidence tell patients that it should not affect the outcome in that regard. So as soon as the guidelines then recommend that we can presume after they are amended and reviewed, we will do our best to get the patients in as quickly as we can to continue with their fertility journey and help them get pregnant.
Great, thank you. All right, so if here's another question. My husband is scheduled for sperm retrieval. Should men be freezing their sperm right now?
This is also a tricky one simply because we just do not have a lot of information. We do not know if the coronavirus, for example, can be transmitted through semen. So the current guidelines are that if it is a non-urgent procedure, for example, you want to harvest testicular sperm for IVF cycle, delaying that a few months is not going to really make a difference. So we recommend not doing it at this time. However, if the male partner is approaching fertility altering therapy like chemotherapy or radiation for cancer and it will render them potentially infertile, we absolutely recommend they continue with the sperm harvest and we will freeze the sperm so that they have that after their treatment.
Okay, thank you. Thanks. Okay, and this question is asked quite often, and it's a very pressing one for women throughout the United States and actually globally right now. And is it currently recommended to delay getting pregnant?
Yeah. And that's something that could be particularly sensitive to folks who may require fertility professionals to help them conceive. At present time, there is no blanket recommendation not to conceive for the general population. The impact of the coronavirus pandemic is still poorly understood, and it is not known exactly how that might affect each individual stage of the process. And we we definitely advise in caution. And so as we find out more information, I think we will be able to advise folks in a more specific way. But at this time, what is known is that coronavirus does not appear to affect pregnant women in a way that makes them more vulnerable than a lot of other individuals, which was, for instance, the case with regular flu.
Right.
Flu definitely made pregnant women much more susceptible, and it's very dangerous to be pregnant during the Spanish flu pandemic. It doesn't appear to be the case with coronavirus, which is something that's potentially reassuring, but more information will be available.
Okay, great. Thank you. Okay, so if I've had my fertility treatments put on hold, what is something I can do now to prepare for pregnancy until I can go back to my clinic and begin treatment?
Yeah. This is a very good question and a very good time, because we should be encouraged to use this time productively. So there's definitely lots of things that people could do to optimize the chances of success. Weight management, if it applies to individual circumstances, is definitely a big thing. So we are connected with weight management experts. We have a very active collaboration with folks who are helping to have success with weight management in conjunction with fertility treatments. There are other things that could be done at this time, is maintaining the overall well-being. Definitely there are things that could be done. We heard recently that somebody was able to complete a race on their balcony. So, I don't know if he did it.
Yes.
News. So my kids got some sort of an invite for to do a race at home, either on a treadmill or just, I guess, in your room just to drive everyone crazy. But just something that definitely could be done. It is important to maintain sanity, and so we definitely have mental health professionals who are open to telehealth visits, and a lot of things that could still be done to maintain your and improve your chances of success, and a lot of things about counseling and other conditions that may need to be optimized. Like, we just made a decision with some patients to see if we can proceed with some medications that will improve the chances of successful implantation and embryo transfer. And so this is a good time to do it. So we're pursuing this at this time. I think you should definitely make arrangements to speak with your provider. And I think it's important to realize that even though this is a very difficult time, it's probably the most difficult time since World War II. And we just had a discussion with our staff yesterday that there is a reason why people who have emerged from World War II were called the greatest generation. So it doesn't escape me to think that there is a common phrase: if it doesn't kill you, it makes you stronger. So you have to be smart and do whatever you can to make sure it doesn't kill you. But I think we will emerge strong from this, and I think this is not going to be forever. And if anything, we're gonna be keeping our doors open. And I also wanna use this opportunity to thank the Colorado State Legislature and the governor for signing the law for insurance coverage of fertility treatments yesterday. That's
fantastic news. Yep.
And it's really something that will encourage a lot of people to have better access to care. And I think we should see this, the thinking that there's going to be a coronavirus boom 9 months from now, from all the folks who are stuck at home. And so fertility treatment for fertility treatments is probably going to come 10 months from now. So come and see us now so that you're all ready to go.
Perfect. Love it. That's great. Thank you, Dr. Polotsky. So let me just make sure I understand from the last couple of questions. So it's, because there's confusion about trying to get pregnant or trying not to get pregnant. And the current recommendation is that there is not one. So it's little is known about the COVID virus. So it's fine to continue to try. If you are, if you must have infertility treatments to get pregnant, you don't have to be completely hopeless right now. Take care of your health. Well, either way, take care of your health and get, contact your clinics to see what you can do to get fit for pregnancy. And then, as you said, Dr. Polotsky, we emerge from this stronger and be ready to go once this has ended.
Yeah. No,
Sound
absolutely.
right?
Yeah.
Great. Okay, so we had a couple questions come in. Here's one question. I'm curious about the risk to early pregnancy if by chance we conceive during this time.
Any pregnancy should be followed just as it should be in a regular set of circumstances. So so once somebody is pregnant, we are pursuing with ultrasounds and with regular evaluations that are typically recommended and indicated. And so this should not be postponed.
Okay, great. All right, and another question, I think we just have time for one more. Would love to know about trying to conceive if both parties are healthy. So that goes back to that other question. See, it's asked, the same question asked in different ways. Many people are wondering. So how about we answer it one more time?
So if you have any questions, just seek professional advice. And so, so call us. We have telehealth slots available now. We're not doing any elective surgeries, and so I definitely have time on my hands to see that we can get this done. So it's really individual circumstances may vary, and we'll be happy to help.
Okay, great. And then just to follow up with that question, if they're both healthy and in an area that's not, at the, like New York or, Colorado's, we're on lockdown. If both parties are healthy, is it okay to try and conceive?
Yeah. So at this time, there is no blanket recommendation not to conceive. It just
anywhere in the U.S.
Correct. You should exercise caution.
And it might help with fitness and stress relief.
That's fantastic. Great. Thank you, Dr. Nel-Themaat. All right. Well, thank you very much for being with us here today and answering those questions. It was very helpful. And to our viewers, thank you for joining us. We will take these questions and answers and wrap them up in a blog, and we'll have it available online at www.kindara.com by next week, early next week. So thank you again, and have a wonderful day. Thank you.
Thanks.
And to all our listeners on Facebook, I just want to emphasize again. So today we should celebrate great news, and so send your thank yous to the governor, to the state legislature that approved this bill yesterday, so that we can improve access to fertility care in Colorado.
Yes.
And that can also be a maybe start an initiative in other states that do not have current coverage. It shows you anything can be done if people come together, stand together, and really reach out to their legislators, that you can make a difference.
Yeah, great. Yes. Cheers to that. Thank you.